All right, guys, so it's time to get a vasectomy, right? Yeah, I think you've seen some of my videos previously about vasectomies on my website. You know, I had one, and I kind of like to walk through with patients, not just the experience from us being the proceduralist, the person doing the vasectomy, but also kind of my experience. There, first things first, we're all nervous. I was too. I don't blame you. I understand. But a lot of what the nerves come from is stuff that we make up in our mind. We get really, really nervous about something that actually is not as bad as you think. So having gone through the vasectomy experience, I can tell you that although I was nervous too, I was pleasantly surprised at the end of it all and said, okay, wasn't as bad as I thought. Now, when you get a vasectomy, and I'm talking about from the nuts and bolts when you walk in the door of our office, you're going to walk in, you're going to check in, we're going to get you back into the procedure room. We're going to spend some time going over some instructions and get you ready for the procedure, for me to actually do your vasectomy. From there, the actual procedure itself actually goes by pretty quickly. Typically, we'll get you all ready and numbed up and all that good stuff, and then I'll get ready to do the procedure. But first, I will step out, send out some prescriptions, get your paperwork ready, let that local anesthetic take effect so you don't have as much discomfort. Once all that happens and we are able to start the procedure, honestly, and most often, it's going to take us 10, 15, maybe 20 minutes at most. There's different ways to do vasectomies you may read about online, but the biggest one, the one that's most of us will do, is what they call the no-scalpel technique. Now, the no-scalpel technique doesn't mean we don't make any sort of holes or do some sort of Star Trek-based type surgery. We actually do make a hole, just with a different style of an instrument. But once we do that, we make one small incision in the sac and do our procedure through that small incision. And we're talking about something the size of a small puncture wound. After we get the vasectomy done, there's usually one small stitch, or sometimes not even at all, in the scrotal sac, and you're on your way home. My biggest piece of advice is that I give patients after this procedure is this. I certainly advise you, go straight home. Don't stop off and go shopping at Costco or any of the rest. Two is definitely follow the rules about ice packs. Ice packs are the best things you can possibly use for discomfort. Not only does it help with discomfort, it helps with swelling and of course, any bruising or things that you may experience afterwards. So head home, get ice packs on your boys right away. Once you get the ice packs on your guys, you're sitting at home and you're relaxing. One of the things I really encourage people is this, and I didn't listen to my own advice, and that's how I know how important it is. So a lot of guys will say, well, it's not that big of a procedure, and try to get up and go do a lot of the normal activities they would the next day. It's not a good idea. Truly, sit on the couch, feet up, ice packs on the boys, taking it easy for the weekend. So most often we'll do vasectomies on a Friday. Now, we don't always have to do that. We'll accommodate your schedule. But when we do a vasectomy on the Fridays, I tell folks, listen, Friday, Saturday, Sunday, just hang out on the couch. Don't do much. By Monday, you can get back to most normal activities. The only restrictions after that, honestly, was I do hold you off from having intercourse for at least a week. And any really heavy lifting or straining, that's particularly if it's not really necessary, take that week off too. Outside of that, most people can get back to work and back to their regular routine by that following Monday or, a couple of days later. Like I said, I didn't listen to my own advice, and I wish I had. I think I was a little bit more comfortable than I needed to be because I was a little bit of a knucklehead and didn't listen to what I write down for my patients. So take it from me when I tell you, just take it easy. It's a great procedure. It's simple, it's straightforward. It's a lot less risky than what our counterparts have to go through, and it's definitely worth your time.